Good afternoon, and welcome to the May 11th Community Update. My name is Stacy Wood, and I serve as a Public Information Officer in the Emergency Operations Center. As a reminder, this Community Update is available in Spanish on the Buncombe County Health and Human Services Facebook page, and that can be found on Facebook at BCHHS. Today's updates come from Dr. Jennifer Mullendor, Buncombe County Public Health Director and Medical Director, Fletch Tove, Buncombe County Public Health Preparedness Director, and Dr. William Hathaway, Chief Medical Officer for Mission Hospital. And today we will get started with an update from Dr. Mullendor.
Good afternoon. As of noon today, there have been 102 lab-confirmed cases of COVID-19 in Buncombe County residents and 4 COVID-19 associated fatalities. Over 3,100 tests for COVID-19 have been completed in Buncombe County residents since the start of the outbreak. Due to historic and present-day inequities created by structural racism, communities of color are being disproportionately impacted by COVID-19, both nationally and locally. Our local data shows that 34% of lab-confirmed cases in our county have been in individuals who identify as Latinx. The community testing sites that are rolling out starting tomorrow are primarily for walk-up traffic. They will rotate throughout Buncombe County in the coming weeks to meet the needs of people with limited access to healthcare providers who are testing for COVID-19, people who face financial or transportation barriers to obtaining tests, and others who have no direct healthcare access. Testing at these events is available to both insured and uninsured individuals with no out-of-pocket cost. Those with health insurance should bring their insurance information with them to the testing site. For people who have symptoms of COVID-19 and have transportation, but do not have access to a healthcare provider who is testing for COVID-19, please call one of the following medical facilities to be screened for COVID-19 testing. And more information can be found on our website. But there's Mayheck Family Health Center at Biltmore, which is off Hendersonville Road, the 4 Mercy Urgent Care sites throughout the county, and Range Urgent Care on Merriman Avenue. Again, if you have transportation and you're having symptoms of COVID-19, you don't have to wait for one of our community testing sites. Pick up the phone, call one of these facilities to be screened and then scheduled for testing. We also hope that people will spend a few minutes answering some simple questions about their symptoms on our symptom checker. And remember, the symptoms of COVID-19 have expanded to include cough, shortness of breath or difficulty breathing, fever, sore throat, chills, repeated shaking with chills, muscle pain, headache, and a new loss of taste or smell. Use the Buncombe County COVID-19 self-checker if you have these symptoms. It's a quick, confidential tool available online or by phone to help you determine if you have COVID-19 and should seek medical care and testing. You can go to buncombeready.org and click on the self-checker banner. You can also call the Ready team at 828-419-0095, Monday through Friday, 8 a.m. through 5:30 p.m. You will need to share some information about your health history, any symptoms you're having. And if your results indicate you need testing, you will be given information on where testing is available. Currently, testing for COVID-19 is focused on individuals who are having symptoms of COVID-19. At this time, those without symptoms of COVID-19 are not routinely to be tested, except during the situation of an outbreak at a long-term care facility, or potentially if they are identified as close contacts to a case. Right now, our best tools in slowing the spread of COVID-19 are still physical distancing, washing your hands frequently and thoroughly, and monitoring yourself for symptoms. Remember the 3 W's when you leave home. Wear a face covering, wait 6 feet apart from others, and wash your hands frequently. What you do, what we all do matters, and what you are doing is working. Please stay the course. Be strong and do your best to keep yourself and your family and community as safe as possible. Thank you. I'll now turn it over to Fletcher.
Good afternoon. I'm Fletch Tove, Public Health Emergency Preparedness Director. On Friday, we entered phase 1 of the governor's reopening process. I just want to take a moment to revisit what that means for residents of Buncombe County. The biggest difference is that several restrictions on retail were lifted, and so there are now many more businesses open in the community. These businesses must comply with specific directions from the state as to how they are allowed to operate. Our stay home, stay safe order remains in effect. People should still stay home as much as possible, but the variety of reasons for which they can leave the home is expanded. If you do need to leave home, as Dr. Mullendorf said, know your W's. Wear a face covering, wait 6 feet apart, and wash your hands with increased frequency. For more information on what phase 1 means for us, visit buncombeready.org. That's buncombeready.org. There, you can find an article for our Buncombe County Stay Home, Stay Safe local order, and you can find the newest declaration itself, along with the frequently asked questions FAQ document and the phase 1 transition chart. You can also see the article for public health material for local industries. This is shopping and general guidance for everyone, as well as our health screening tools for employers. Finally, we've received several reports of people being mocked or berated for wearing a face covering in public. This sort of behavior, to be frank, is despicable. The purpose of these coverings is to reduce your chance of transmitting the virus to others. It's not about protecting yourself, it's about protecting others. Wearing face coverings in public is a sign of caring and compassion. It's a sign of community solidarity in these challenging times. And it's a recognition that the consequences of your actions may extend past your own household and affect the lives and families of others. The governor and Buncombe County are not mandating the use of face coverings in public, but we are strongly encouraging them when in the proximity of others, particularly if you cannot maintain a consistent 6 feet of distance from others. Individual stores and businesses that have opened up for phase 1 of operations have the right to require patrons to wear face coverings to enter their business. Public health will support them in these decisions, and the public must observe these requirements that these independent establishments put in place to ensure the health and safety of themselves, their staff, and their patrons. As always, let's be safe, Let's be smart, and let's take this step by step. Thank you.
Good afternoon. I'm Bill Hathaway, and I'm the Chief Medical Officer at Mission Health, and it's a privilege to be here this afternoon. I want to first take a moment to thank the city, the county, and the community for all that you've done to help flatten the curve. It's really remarkable at how well things have gone to date. I'd like to also cautiously remind us that despite having flattened the curve, we are not out of the woods yet, and we need to be mindful of the 3 W's. I'd first like to address our resumption of services and surgical procedures and imaging tests at Mission Health and across the 18th county region at all of our facilities. As I think people remember, it was about 2 months ago that we essentially had a shutdown on our our elective care provided to patients. And we did that for a variety of reasons. The first was to preserve protective equipment for our healthcare workers. The second was to preserve testing for patients who are sick. The third was to maintain capacity for COVID-19 patients when they came to the hospital, specifically ICU beds and ventilators. And lastly, it was to minimize spread throughout the community. Well, we have some good news to report so far. To date, we have had a total of 34 patients at Mission Health System who have received care for COVID services in an inpatient setting. 4 of these presented to the emergency department and were subsequently discharged. 6 were admitted and most unfortunately passed away. 22 were admitted and discharged to home. And today we have 2 patients in the hospital with COVID-19. Our capacity to care for these patients has remained robust. We put into place plans to expand our ICU capacity by doubling and even tripling if needed be. We have, of course, not come to need that, and we are grateful for that. In addition, we had concerns about ventilator capacity, and we have just barely scratched the surface of our total need for that at this point in time. And again, for that, we are grateful, and it's a reflection of the community flattening the curve. Our protective equipment supply chains have become hardened, and we're feeling more confident in them. And because of all of this, we feel it is time to resume what has been termed elective surgeries and procedures and imaging tests throughout the health system. And we have actually done that as of last week. For patients who will be receiving surgical care at Mission, we have complex algorithms put into place to screen the need for testing prior to the procedure. Patients who are either deemed high risk or who are undergoing high-risk procedures will be tested prior to their procedures. That information and that policy and procedure will be explained to patients and their families when this testing is scheduled through our preoperative evaluation process. In addition, we have made a minor modification to our visitation policy. We will continue to function at what we call Level 3 visitation restriction, meaning no visitors on the floors of the hospital, except in very rare circumstances, such as pediatric cases, end-of-life circumstances, and labor and delivery. In addition, however, we will allow 1 visitor to accompany a patient during the surgical procedure, but if the patient is to stay overnight, there will be no visitors for that person in the hospital. And that is, again, to protect the patients, their family members, and our staff from inadvertent transmission of this very terrible illness. I want to emphasize to people that safety has been and always will be our #1 concern for our patients and their families and for our staff. And I want to emphatically emphasize that the hospital is a safe place to get care at this time. We have carefully segregated patients who are receiving care for COVID disease and segregated the caregivers so that they will not overlap with those who don't have COVID-19. And in addition, we have strict isolation protocols in place to protect all patients at all times from any transmissible diseases. It's very troubling to me that we have seen not just in Western North Carolina or the state or the country, but everywhere, a decline in patients seeking care for emergency-type illnesses. Two examples come to mind immediately: heart attack care and stroke care. For reasons which are not entirely clear, those volumes have dropped 25 to 30% across the board around the state. That is not because the disease has gone away. To me, that is a reflection that people are avoiding care. And there is nothing worse that you could do than to stay at home if you need emergency medical care. I want to emphasize again, our hospitals and our offices and our practices are safe places for people to get care. We'll continue to provide masks for all patients and visitors when they come to the hospital. We'll continue to provide temperature checks and screening questions at the door. The risk of staying at home while you're experiencing a heart attack, a stroke, or any other serious or potentially life-threatening illness is far greater than the risk of getting COVID in any of our facilities. One final comment about testing. Testing is ramping up, as Dr. Mullendorf pointed out early in the press conference. Mission Hospital and health systems and the practices are also increasing our testing. We have in-house testing and have had in-house testing for a month for patients who are hospitalized, and we're utilizing outside laboratories to supplement that. If you are a patient in one of our practices or present to our urgent care for needs and it is deemed that you need testing, you will get testing. And then I want to wrap up again with the 3 W's. We didn't get here because we were foolish. We got here because we were cautious and very purposeful in our intent. And I want to remind you to wear a mask when you're in the community, to wait 6 feet away from other people, and to wash your hands frequently so that we can continue to flatten the curve and come out of phase 1.
So in conclusion, no matter who you are or where you come from, we are all in this together. We believe in you, Buncombe. Stay safe, be well, stay engaged. Our next community update will be on Thursday at 2:30 p.m. Thank you.